in-person consultation. Like, because, you know, a lot of times, especially now, people travel to get their surgeries, and oftentimes, you know, you submit photos, but it doesn't always tell you everything you need to know, as opposed to, you know, seeing the patient in person. So, like, how important is it for, you know, a patient to go and visit the physician in person before having the hair transplant?
Can I answer? It's very, very important, because you may see someone who seems to be a good candidate with a good density, but when he comes and when you start to inspect, when you use your dermoscope, photo finder, and other equipment that we have, we may find that he has 50% miniaturization, 40. So it will be impossible. I remember a case of a patient who traveled from the other side of Earth, and
Wow.
he couldn't do, and he was devastated, but this was the truth. It's very important to see in person the patient, not the day before, for me even like a month before. So you will take the measurements, you will have the density, you will see the quality of the follicles, if they are miniaturized, if they are not. You will make a proper design. The patient also will have time to think about it, to think about his possibilities, because people are coming and they want to return in their 20s, but
Yeah.
you need to be truthful to them,
Yeah.
because they may think in the future. So you need also to give time to the patient to digest what you have to tell him, but also to avoid any mistakes. You need to see him to see that he's a proper candidate.
Yeah, I mean, I think.
Melvin, I'm not gonna cut you off. I just received an email this morning
Mm,
from my friend in Miami, Jeffrey Epstein.
mm,
Jeff sent me a mail. Buddy, thank you for seeing a patient this week who was supposed to come to me for surgery,
mm.
and you catch a scarring alopecia, so the surgery is canceled.
Wow.
That saved him a trip to Miami to come for surgery and to find out that he had a scalp disease that he needs to be treated.
Yeah.
So this shows you how important. When you have good relationship with some of your peer,
Yeah,
they refer a patient to you,
yeah,
and they're not afraid that you're gonna steal the patient.
yeah,
Because if the patient come genuinely and say, "Listen, I'm gonna go to see Jeffrey Epstein for my surgery, but because he's on the other side, can I have a consultation with you and sending the fine?" I say yes, and I do it the way I would do for all my patients. There are type of hair loss that are not surgery, are not treatable by surgery.
Mhm.
We see more and more scarring alopecia that mimic androgenetic alopecia. So it is important to get your scalp examined thoroughly by someone who knows what they're looking for. Because just passing a hand into the scalp of a patient and say, "Oh, you're a good candidate," those days are over. People need to be evaluated properly.
Yeah,
Most of the failed hair transplant is because there was some underlying scalp condition that were missed. The
yeah,
more we understanding the scarring alopecia, the more we understanding examination of the scalp before the surgery, the more we start catching things that we didn't know that exist 10 years ago.
yeah. No, absolutely. And I think, you know, to know what your donor looks like, you can't just use the naked eye, you know, because sometimes miniaturization, you have to see with high magnification. You can't see it with your eyes. You need to really, like you said, take a dermoscope and see, okay, how many of these hairs are miniaturizing. If there's more than 20, more than 30%, there's an issue. You know, the scalp looks inflamed, there's something going on. You probably want to check that out before having surgery, because
Exactly.
yeah, you don't want to just have surgery and have it fail, and then, you know, maybe it wasn't the surgeon's fault, but you know, you want to make sure you cross your T's and dot your I's, which is very important.
Well, thank you so much for watching, and if you'd like to know how to prepare and what would happen during a consultation, then feel free to click on the next video for preparation and attending a consultation. And we'd be very happy to hear from you and arrange seeing you with Dr. Kostis or Dr. Bisanga in person. Take care, and thanks again for watching.